Wow, that's incredible. So echocardiography isn't just about creating images. It's also about providing all this detailed information about the heart's function and hemodynamics.
You got it. It's like having a conversation with the heart, listening to its rhythms and understanding its messages.
Exactly. Now, I'm curious to learn how we can use this technology to diagnose specific heart conditions.
That's where we're headed next. We'll explore how echocardiography helps us identify and understand various conditions from valvular heart disease to congenital defects.
Okay, I'm ready to dive in. Let's explore those specific conditions and see how this technology puts those sound waves to work.
Let's do it. We'll start with valvular heart disease, a group of conditions that affect the heart valves. We'll look at common ones like aortic stenosis, mitral regurgitation, and mitral stenosis.
I'm fascinated to see how we can spot these conditions using echocardiography and then how that information guides treatment decisions.
It's pretty amazing, and we won't stop there. We'll also touch on other conditions that echocardiography can help diagnose, like congenital heart defects, pericardial effusion, and even cardiac tumors.
Wow, the range of applications is incredible. But for now, let's take a quick break. When we come back, we'll delve into the specifics of how we use echocardiography to diagnose and manage those valvular heart diseases.
Sounds good. See you in a bit. See you soon.
Okay, so let's jump back into valvular heart disease.
Sounds good.
Before the break, we were about to unravel how echocardiography tackles this.
Mm-hmm.
And I'm really curious to see how these sound waves lead to diagnoses and treatment decisions.
It's pretty incredible how much we can learn from sound waves alone.
I bet. So shall we start with aortic stenosis?
Let's do it.
You mentioned it earlier that it's kind of like trying to force water through a tiny opening in a hose.
Right.
I can imagine that would put a lot of strain on the system.
It does. In aortic stenosis, the aortic valve.
Which controls blood flow from the heart to the body.
Exactly. That valve becomes narrowed.
Okay.
Imagine that narrow opening in the hose.
Okay.
And now picture the heart having to pump blood through that restricted space.
So the heart has to work much harder to push the blood through.
Yes, and that increased pressure puts a strain on the left ventricle.
The heart's main pumping chamber.
Exactly. It's like a weightlifter constantly lifting heavy weights. It takes a toll.
Right. So how does echocardiography help us pinpoint aortic stenosis? What are we looking for?
Echocardiography allows us to actually see that narrowed valve.
Wow.
And assess how severe it is.
I see.
We can measure the velocity of the blood flowing through the valve.
So the faster the flow, the narrower the opening. Like a river rushing through a gorge.
That's a great analogy. We can also use the Bernoulli equation.
Which we talked about earlier.
Exactly. We can use it to estimate the pressure difference across the valve.
So we can actually measure how hard the heart is working to overcome that obstruction.
Exactly. And based on these findings...
From the echocardiogram.
Yes, we can determine how severe the aortic stenosis is.
Okay.
And that helps us guide treatment decisions.
So those results help doctors decide if medication is enough or if a valve replacement is needed.
Exactly. Sometimes medication can manage symptoms and reduce the strain on the heart. But in severe cases, a valve replacement surgery might be the best option.
To restore normal blood flow.
Right.
Okay, that makes sense. Now let's move on to mitral regurgitation.
Mitral regurgitation.
Yeah, what's going on in that condition?
With mitral regurgitation, we're dealing with a leaky valve.
Leaky valve.
Yeah, the mitral valve.
Which separates the left atrium and left ventricle?
Exactly. That valve doesn't close tightly, allowing some blood to flow backward.
So instead of all the blood moving forward into the aorta, some of it leaks back into the left atrium.
You got it. And echocardiography is great at detecting this backflow.
Oh, really?
We can actually see that turbulent jet of blood leaking back through the valve.
It's like a tiny waterfall in the heart.
I like that.
So the size and direction of that jet tell us how serious the mitral regurgitation is.
Yeah, generally a larger jet means a more severe leak.
Okay.
But we also look at how the leaky valve affects the heart chambers.
What kind of impact does it have?
Well, the left atrium might become enlarged because it's handling more blood than it should.
Because of the leak.
Right, and the left ventricle might also become dilated and overworked as it tries to compensate.
So echocardiography helps us see the leaky valve and its effects on the heart.
Exactly. It gives us a really comprehensive view, and that helps determine the best course of treatment.
So depending on the severity, treatment could range from medication to surgical repair or even valve replacement.
You got it. Echocardiography helps guide those decisions.
Makes sense. Now let's talk about mitral stenosis.
Okay.
What happens when that mitral valve becomes stiff and doesn't open properly?
Mitral stenosis is basically the opposite of mitral regurgitation.
Opposite.
Yeah, instead of a leaky valve, we have a restricted valve.
I see.
It's like trying to push open a stiff door.
Okay.
It takes more effort and the flow is limited.
So the blood has difficulty moving from the left atrium to the left ventricle.
Exactly. Echocardiography shows us those thickened and immobile leaflets of the mitral valve.
The parts that should be opening and closing smoothly.
Right. We can also measure the blood flow velocity through that narrowed opening.
Just like we did with aortic stenosis.
Exactly. One key measurement we look at in mitral stenosis is the pressure half-time.
Pressure halftime. What's that?
It tells us how quickly the pressure difference across the valve decreases during diastole,
Diastole.
which is the heart's relaxation phase.
So it's like measuring how long it takes for the pressure to relax after the heart squeezes.
That's a great way to put it. A longer pressure half-time means the valve is more stenotic.
So it's taking longer for the pressure to equalize.
Exactly.
I see. So we use echocardiography to visualize the problem, take measurements, and use that information to guide treatment.
You got it. And just like with the other conditions, the severity of the mitral stenosis helps determine the treatment approach.
So medication might be enough for mild cases, but severe cases might require a procedure to open or replace the valve.
Exactly. Are you ready to move beyond valvular diseases?
Absolutely. You mentioned congenital heart defects earlier.
I did.
I'm really curious about those.
Congenital heart defects are abnormalities in the heart structure that are present at birth.
At birth.
They can range from mild to severe and can affect different parts of the heart.
Okay.
One common type is septal defects.
Septal defects, what are those?
They're basically holes in the walls that separate the heart chambers.
Holes in the walls?
Yeah. We have two main types, atrial septal defects, which are holes between the two upper chambers.
Okay.
And ventricular septal defects.
Ventricular septal defects.
Which are holes between the lower chambers.
So instead of blood flowing neatly through the heart, it can kind of take a detour through those holes.
Exactly. It's like a shortcut in the heart's slumming.
And depending on the size and location of the hole, that can cause problems.
Yeah, definitely. It can cause heart murmurs.
Heart murmurs.
Yeah, which are abnormal sounds caused by turbulent blood flow.
I see.
Or even more serious issues like heart failure.
So how does echocardiography help in these cases? What are we looking at?
Well, echocardiography acts like a detective tool for these defects.
A detective tool.
It helps us pinpoint the hole's location and size, see how much blood is flowing through it,
Okay.
and see how it's affecting the heart overall.
So it helps determine the severity and whether it needs to be closed.
Exactly. Echocardiography guides those treatment decisions.
That's incredible. Now let's move on to pericardial effusion.
Pericardial effusion.
Yeah, it's a mouthful, but the concept seems pretty straightforward.
It is. It's basically a buildup of fluid around the heart.
Okay.
The heart is surrounded by a fat called the pericardium. And sometimes fluid can accumulate in that space.
So it's like the heart has its own water balloon.
That's a good analogy. And this can happen for different reasons, like inflammation, infection, or even heart surgery.
Okay.
Echocardiography helps us see that fluid surrounding the heart and measure how much is there.
So it helps assess the severity and maybe even the cause?
Right, and that guides treatment decisions. Sometimes the fluid needs to be drained, other times it might resolve on its own.
Echocardiography helps make those calls.
Exactly. Now for our last stop, let's talk about cardiac tumors.
Cardiac tumors in the heart.
Yes, but thankfully they're quite rare.
Okay.
But when they do occur, echocardiography can help detect them.
What can it tell us about them?
It can show us if a tumor is in the chambers or on the valves. We can see its size location and even get a sense of its composition.
Whether it's solid or fluid-filled?
You got it.
So echocardiography helps us determine the type of tumor and how it's affecting the heart.
Exactly. And that information is crucial for planning further investigations.
Like biopsies.
Right. And deciding on the best treatment.
Which could be surgery, chemotherapy, or radiation therapy.
It all depends.
It's amazing how much information we can get from these sound waves. It's like we have a superpower to see inside the body.
It really is remarkable. And we've only scratched the surface. We've talked about valvular disease, congenital defects, pericardial effusion, and cardiac tumors.
We have.
But there's a whole other area of echocardiography that's pushing the boundaries even further. Advanced techniques.
Advanced techniques. That sounds intriguing. Tell me more.
Well, one exciting area is stress echocardiography.
Stress echocardiography.
Yeah, instead of looking at the heart at rest, we can see how it functions under stress.
Stress as in making the heart work harder.
Exactly. We can have the patient exercise or give them medication that mimics exercise.
So we're giving the heart a test run to see how it handles pressure.
Right. And this can reveal problems that might not be obvious when the heart is relaxed.
Like blockages in the coronary arteries?
Exactly. We can see changes in the heart's wall motion during stress.
That's incredible. Now, what other advanced techniques are there?
Well, there's also transesophageal echocardiography, or T.
T, you mentioned that earlier.
It allows us to get much clearer images of certain parts of the heart.
And I remember you said it involves a probe in the esophagus.
Yes.
That still seems strange to me.
I know it sounds counterintuitive, but the esophagus sits right behind the heart.
Oh, it's right.
And that lets us get much closer than with a regular echocardiogram.
So it's like getting a closer look from a different angle.
Exactly. T gives us exceptional images of structures that are hard to see with traditional echocardiography.
Like the back of the heart.
Yes. And the valves and the aorta.
So T is like having a VIP pass to the heart.
I like that.
What other advanced techniques are there?
There's 3D echocardiography. Instead of flat 2D images, we can create a three-dimensional model of the heart.
Wow. It's like going from a flat map to a 3D globe.
That's a great analogy. It's a game changer for visualization, especially for surgeons.
Oh, I can imagine. They can see the heart from every angle.
Exactly, and plan procedures with much more precision.
Incredible. So what else is there?
Finally, we have strain imaging.
Strain imaging. What are we straining?
We're looking at how the heart muscle deforms as it pumps.
How much it stretches and squeezes.
Right.
So it's like we're zooming in on those individual muscle fibers.
Exactly. Strain imaging helps us assess the heart's contractility.
Its ability to contract forcefully and efficiently.
You got it. And that's essential for pumping blood throughout the body.
It's really amazing how far we've come from those early fuzzy images to these sophisticated techniques.
It is, and these techniques are constantly evolving, pushing the boundaries of what we can see and learn about the heart.
It's an exciting time to be in cardiology.
It really is. We're constantly finding new ways to use these sound waves to diagnose and manage heart conditions.
Well, we've covered a lot of ground in this deep dive.
We have.
From basic physics to advanced techniques, it's clear that echocardiography is a powerful tool.
It really is, and it's a testament to human ingenuity and our desire to understand the human body.
Now, as we wrap up this episode, what's the one thing you want our listeners to remember about echocardiography?
I want them to remember that echocardiography is more than just a diagnostic tool. It's a way to listen to the heart, understand its struggles, and help guide its healing.
That's a beautiful way to put it. And to leave our listeners with a final thought to ponder, if we can do so much with sound waves alone, what other wonders await us as technology emerges? What new frontiers will we conquer in cardiac imaging?
The possibilities are endless. Thanks for joining us on this deep dive.
Okay, so before we got sidetracked by all those other incredible echocardiography techniques, we were talking about how we can actually stress the heart to learn more about its function.
Oh yeah, stress echocardiography.
Right? Can you refresh my memory on that?
Absolutely. Stress echocardiography is a technique where we observe how the heart responds to exertion, either through exercise or medication.
So it's like we're giving the heart a challenging workout to see how it performs under pressure.
Exactly. Imagine a car that runs fine at low speeds but starts sputtering when you hit the gas.
Oh, okay.
Stress echocardiography is like taking the heart on a high-speed test drive to see if any issues like blockages in those coronary arteries show up.
Okay, that makes sense. Now, you mentioned another technique called TE.
Transesophageal echocardiography.
Right. That one sounded a bit intense to me.
It might sound intimidating, but it's actually very safe and valuable.
Okay, good.
It lets us get incredibly clear images of certain heart parts that are hard to see with traditional echocardiography.
And if I remember correctly, it involves inserting a probe into the esophagus.
You're right.
Why the esophagus? That still seems like a weird way to look at the heart.
I know it sounds counterintuitive, but remember, the esophagus sits right behind the heart.
Oh, that's right.
So by putting the probe there, we get much closer to the heart and avoid interference from things like ribs and lung tissue.
So we're basically getting a backstage pass to the heart with TE.
Exactly. We get a much clearer view.
So TE provides those detailed images, but what else can we do to enhance our view of the heart? You mentioned 3D echocardiography.
Yes. With 3D echocardiography, instead of those flat 2D pictures, we can create a three-dimensional model of the heart.
Wow.
We can rotate it, zoom in and out.
That's incredible. It must be like going from a flat map to Google Earth, where you can really explore every detail.
You got it. It really changes the game for visualization, especially for surgeons who are planning complex procedures.
Oh yeah, they can basically hold the heart in their hands virtually.
Exactly, and plan their approach with incredible precision.
Wow, that's amazing. And then there was that last technique you mentioned, strain imaging.
Right. With strain imaging, we're essentially looking at how the heart muscle deforms as it pumps blood.
Deforms as in how much it stretches and contracts.
Exactly.
So we're basically analyzing the heart's micro-movements.
We're seeing how those tiny muscle fibers are working.
And that tells us about the heart's contractility.
Exactly. Its ability to contract forcefully and efficiently.
Which is obviously crucial for pumping blood throughout the body.
It is.
It's just mind-blowing how much information we can extract from these sound waves. We've gone from basic principles like the Doppler effect and image resolution to these highly sophisticated techniques.
I know. It's amazing how far we've come.
And it's all thanks to human curiosity and our constant desire to learn more.
Absolutely. We're always looking for new ways to use these invisible waves to unlock the secrets of the heart.
Well, we've covered an incredible amount in this deep dive into echocardiography.
We have.
Starting with that board review document, we've explored everything from basic physics to the most cutting-edge techniques.
And we've unpacked these complex topics using everyday language and examples to make them easier to understand.
And we've seen how all of this helps diagnose and manage a whole spectrum of heart conditions.
It's been quite a journey.
It really has. So as we wrap up, what's the key message you want our listeners to take away about echocardiography?
I want them to remember that it's not just about diagnosis. It's about listening to the heart, understanding its challenges, and guiding its path towards healing.
That's a beautiful way to put it. And to leave our listeners with a final thought, if we can accomplish so much with sound waves alone, imagine what the future holds. What other mysteries of the heart will we unravel with new technology?
The possibilities are truly endless. It's an exciting time for cardiology, and I can't wait to see what we discover next.
Absolutely, and that's a wrap on another deep dive